Vancouver's fentanyl crisis hasn't been a single moment so much as a grinding citywide reality that millennials have grown up alongside and increasingly organized against. For a generation now in their late 20s to early 40s, the toxic drug supply is not an abstract headline. It's the coworker who didn't show up again, the friend's sibling memorial fundraiser, the sirens outside a SkyTrain station, the naloxone kit tucked into a backpack just in case. And in the 2025-2026 calendar years, harm reduction advocacy by millennials has become louder, more strategic, and more publicly contested because the stakes are still life and death. One reason the urgency stays so high is that fentanyl crisis is almost a misnomer in 2025-2026. What British Columbians face is a toxic, unpredictable supply where fentanyl and its analogs can appear in or contaminate many substances. Harm reduction, at its core, responds to that reality with one blunt premise: people can't recover if they don't survive. That's why Vancouver's local response continues to emphasize a mix of strategies, partnerships with community groups, low-barrier supports, and public health-oriented interventions, rather than a single silver bullet. In late 2025, policy changes around prescribed alternatives, often discussed under the broader Safer Supply umbrella, underscored how politically and clinically complex harm reduction has become. British Columbia released a new prescribed alternatives policy in December 2025 with requirements such as witnessed dosing by health professionals beginning December 30th, 2025, an example of government trying to balance access, safety, and concerns about diversion. These aren't just technical tweaks. They ripple into how people access care day to day, and they shape what advocates demand: more availability, fewer barriers, and systems that don't collapse under bureaucracy. Scholarly research from 2025 also shows why the debate is so heated. A cohort study in JAMA Health Forum examined changes in opioid hospitalizations and deaths associated with safer supply and subsequent decriminalization policy in BC, finding increases in opioid hospitalizations in the period studied. Results that get cited by critics and supporters alike, often to argue very different conclusions about what should happen next. Meanwhile, public health scholarship continues to synthesize evidence across and interventions: supervised consumption, naloxone distribution, opioid agonist therapies, and more, emphasizing that overdose prevention requires multiple coordinated tools rather than ideology. So where do millennials come in? Millennials occupy an unusually influential position in Vancouver's harm reduction ecosystem. They are old enough to vote, organize, fundraise, and shape workplace policy, but young enough to be deeply embedded in the city's social media nervous system, where narratives form fast and public pressure can become real leverage. In 2025-2026, you can see millennial advocacy moving in three overlapping lanes. First, grief to action networks. Organizations like Moms Stop the Harm have become a recognizable force, part community support, part public accountability machine, regularly pushing evidence-based policy and compassion-centered messaging. Their late 2025 advocacy content captures a key millennial posture: exhausted by symbolic gestures, but still relentless about forcing the issue into public view. This is activism shaped by loss, not theory. Second, stigma fighting as a strategy, not just a value. Millennials are often advocating with language that deliberately refuses the moral failure framing. That matters because stigma doesn't just hurt feelings. It changes whether people seek help, whether communities tolerate services, and whether policymakers take the politically risky steps that save lives. Research on opioid stigma and harm reduction consistently argues that stigma is a barrier to implementing effective interventions, and public attitudes towards strategies like safer supply or supervised consumption can be shaped by how communities talk about them. Third, policy literacy and rapid response. Millennial advocates increasingly speak fluent policy, exemptions, guidelines, oversight, evaluation, unintended consequences, and health system capacity. That's visible in the way discussions around prescribed alternatives shifted in December 2025, less for or against, more what safeguards, what access, what evidence, what outcomes. It's also visible federally. In January 2026, Health Canada announced that Minister Yara Sachs, then Minister of Mental Health and Addictions, and Canada's Fentanyl czar, would be in Vancouver to meet with impacted communities, an example of how central Vancouver remains to national-level crisis response and how advocacy keeps forcing high-level attention. The tension in 2025-2026 is that harm reduction is simultaneously more mainstream and more polarized than it was a decade ago. In Vancouver, many people accept naloxone and overdose prevention as basic public safety, like seatbelts. Yet the moment you move into bigger structural interventions, prescribed alternatives, supervised sites, decriminalization design, housing plus care, consensus fractures. That's exactly why millennial advocacy matters. It's often the bridge between on-the-ground reality and public legitimacy. They are the generation trying to hold two truths at once, that the crisis is fueled by trauma, inequality, and poisoned supply, and that any policy can fail if it's under-resourced, poorly implemented, or treated like a PR campaign instead of a health system overhaul. In 2025-2026, the most millennial aspect of Vancouver's harm reduction movement might be its tone, less naive optimism, more evidence and accountability. It's the insistence that compassion must come with infrastructure, that slogans must come with staffing, that survival must come with pathways to stability. And above all, it's a refusal to let the crisis be background noise, because for too many Vancouverites, it never was.